blood supply, we'll use this diagram showing the skin here, epidermis and dermis, the subcu tissue with the cutaneous muscle in it, muscle, fascia, and muscle. And we know that in dogs and cats, they have these direct cutaneous arteries that come up in fairly scattered parts of the body, and they turn and run parallel to the skin in the cutaneous muscle. And they send off this subdermal plexus, which are all these little vessels that go up to the skin. And if we follow this along, you see that continuing. And if we were in the same room, I'd point to the far corner of the room and say, there's a direct cutaneous artery coming up over there, and it goes through the cutaneous muscle, and then maybe there's another direct cutaneous artery coming up in the other corner of the room. So there can be a long distance between you and the direct cutaneous arteries. And that's okay, you've got this subdermal plexus coming from all directions, but it does limit us a little bit in how big a flap we can make. So let's make a wound here. And we're going to undermine the skin so that we can cover the wound. Well, when we undermine, we want to do that deep to that subdermal plexus so that blood supply stays with the skin, which means we need to be deep to that cutaneous muscle. So you want to look for that muscle. In some dogs, it's really wispy, and some dogs, it's quite substantial. But you want to be deep to that when you're undermining. And then when you elevate the skin, the subdermal plexus goes with it, and you'll have blood supply as you advance this flap over your wound. If we undermine superficial to the cutaneous muscle, so if we go at this level, now we've just chopped off the blood supply, the little subdermal plexus vessels, and that piece of skin won't survive. And that can be easy to do, particularly in fat dogs. And if you look at this photo here, you can see this dog has a lot of fat between the skin and the cutaneous muscle. And we want to make sure we're undermining deep to this muscle. So here's our cutaneous muscle. And this dog right here, there's our little subdermal plexus. So picture that when you're undermining, and make sure you're preserving those little vessels. If there's no cutaneous muscle, and we'll encounter that like on the limbs, we don't really see any cutaneous muscle there. The rule is to undermine just deep to the subcu. So you go right down along the muscle fascia and leave all the subcu with the skin.